vocational rehabilitation. And I myself, Binoy Matthew KV, is leading the physiotherapy department with the support of B. Marimuthu and Fatima Sumaya. And without much delay, I will now invite Mr. Marimuthu to introduce the resource person of our National Physiotherapy Webinar. Over to you, Mari.
Thank you, sir. Hello and warm welcome to you all. It's a great pleasure for me to introduce our today's speaker, Mr. Biju Nirmal Jacob. He has completed his bachelor's and master's in physiotherapy from School of Medical Education, Mahatma Gandhi University, Kerala. He is a certified Mulligan practitioner from New Zealand, also a certified neurodevelopmental therapist from USA. He has done various paper presentations and publications in national and international platforms. He has more than 13 years of clinical experience in India and abroad. Presently, he is working in the physical therapy OPD of Qatar Rehabilitation Institute, a division of Hamad Medical Corporation, Qatar. Sir, we are very glad to have you as a resource person to share your knowledge to our professionals. Before handing over to the presenter, I would like to remind all our participants to please mute your mic and turn off your video during the sessions. Also, please don't click the present screen option because it may disturb all the participants, and you all can pin the resource person's Google ID to see the slides. You can post your queries at the chat box at the end of the session only. The feedback form will be shared in the chat box at the end of the webinar to qualify for your certificates. And over to you, Biju sir.
Thank you, Mariputhu. Good afternoon to everyone. Initially, I will share my presentation. Hope everyone can hear me properly. As I said, as Mari said, my name is Biju Nirmal Jacob. I am a postgraduate physiotherapist presently working in Hamad. So today we are going to discuss about post-pandemic physiotherapy. See, first of all, one thing I would like to tell, I'm not going to discuss about the physiotherapy rehabilitation which is given for the children or the adults who are admitted in the COVID department. So that is a separate field and we need to give a separate time for that. This is, we are going to discuss about the therapy we are following in our department. So how we are handling the cases, because if we compare Qatar and India during the period of March, April, May and all, we had as many numbers in Qatar. Now it is reduced, but now if you see India, the numbers are increasing and you will slowly come to know that your non-people are affected with coronavirus. And so the thing is that it's more coming close to you. So we are out of that situation, and yesterday I think we had only 196 positive cases in Qatar, and day by day it is reducing, and the government is slowly opening all the shops and all facilities, public gatherings, church, mosque, everything is being slowly opened, and we are back into a normal life. So the physiotherapy department was not closed during this pandemic event in Qatar. So I would like to explain how we manage the past few months in our department. We don't know the person who is coming is positive or not. So we took a precaution so that we can provide therapy. Even patients were ready to, like around 60% of the patients were ready to come for therapy. So let me go briefly into the few slides regarding what exactly COVID. Then I will go to the procedure what we followed in our department. Thank you for this CDC Kozhikode for giving me an opportunity to present. So all of you know that what exactly COVID-19 is. It's a SARS-CoV-2 virus, and it affected in December 19 in Wuhan, China, and resulted in the ongoing pandemic issue. And it's a respiratory disease. All of you are familiar with it. Some people it's very mild, but some people it will become severe acute respiratory illness, sepsis with organ dysfunction leading to death. And the main problem is it can be highly contagious. So it varies from other respiratory viruses in that it appears to be human to human transmission occurring approximately 2 to 10 days prior to the individual becoming symptomatic. So we will not be knowing that a particular person is positive or not. So we need to see everyone as a potential positive case whenever you are dealing with your patients. And transmission is by contact. Virus can occur directly, contact with the infected people, or indirectly by contact with the surface in the intermediate environment. These things are all of you are familiar with, but I'm just to make the flow and just skipping through these slides. And the object used on or by the infected person, example stethoscope or other things, it can also be a chance for the conduction of this virus. Now coming to the current evidence suggests that most of the transmission in COVID-19 is occurring from symptomatic people to others in close contact, and there is also a possibility of transmission from people who are infected and shedding virus but have not yet been developed with symptoms. So this is the most important cases, like pre-symptomatic transmission. Whenever you are going to a COVID positive treatment facility, you know that the virus is there. The patients are positive. The children who you are treating are positive. So you will take 100% care. But when it comes to a department where patients are walking in, you don't know whether they have a symptom, but they are not aware of it. So this pre-symptomatic transmission, you need to be very careful of. The incubation period of COVID-19, which is the time between exposure to the virus and the symptoms of onset, is not to be 5 to 6 days, but it can be as long as 14 days. Some people infected with this COVID virus do not ever develop any symptoms. We had an experience here when we call the patients for a therapy. We take a summary of the patient, like we ask many questions whether anyone had, and some parents they will tell, like okay, none of our family members are affected with this virus. We don't have any problem. Then we ask another question, like, have anyone traveled from abroad in the past these days? Then they say yes, one of my uncle traveled abroad and he came back. And then we asked, like, whether they came to your home. They said yeah, they visited us. And what is their status? Can we check and find it out? Then they say, oh, they are in quarantine. So sometimes they will forget these things and they will not be able to give you the exact answers. So you need to specifically ask the parents regarding is there any exposure. Sometimes they will not understand regarding the exposure, and sometimes these people, when they visit, they will be pre-symptomatic. So coming to the advice of using the mask in context of COVID-19, mask can be used either for protection of healthy persons. So whoever you see, you must see. In our department, we have, like, some patients come without the mask. We provide them one and we tell them the importance of mask, because people are sometimes not aware or not bothered about what exactly is the situation going around. And for the source control worn by an infected individuals, there are two types of mask all of you are familiar with. Commonly we are using the surgical or the procedure masks and the N95 filtering. So this particular filtering face piece mask is used for in case we are treating the positive cases, and I will be explaining later which one to use were in the later slides. Now, coronavirus in babies and kids. So this is the part which we are mainly focusing on this particular presentation today. COVID symptoms are milder in children than in adults. In recent study published in Pediatrics of COVID-19 in Chinese children, 90% of those who tested positive for the disease had mild symptoms or not at all. And I would like to give an example, like one of my patients, the child was affected positive. So I called them for post-infection physiotherapy. Then I was speaking to the mother, and mother said the child was admitted in the hospital. Initially, they were not aware that this is a positive case of COVID virus. And they gave some medication for 2 days. Child was in the house, and the child slowly becoming more vulnerable, more affected, and then they took him to the hospital, and his situation started getting worse, and slowly then they took him to the main hospital, one of the major hospitals here, and they tested him and positive, and they found that the child have multi-system failure. He was in ICU, he was ventilated, and then with medications for a week or 2 weeks of treatment, he is better, he is now back in home. So I asked the mother how the child is now, and the child is better, he is running around. So this kind of cases, I gave a phone consultation, and I provide them with some breathing exercise and endurance activities. I emailed them the exercises to be followed at home. Then after 2 weeks, I again call and check the status of the child, and he is much better. He is almost okay. And the parents were happy. They were really worried initially when I called, but he recovered pretty fast. But his situation was worse. So we don't know which case is positive and which case. So it's always better that you take the baby or the children to the hospital as early possible, according to the direction from the health providers. And these are the common symptoms we can see in case of child. Definitely fever and cough, both in adults and children, but shortness of breath more seen in adults. Children have pneumonia with or without obvious symptoms. They can experience sore throat, excessive fatigue, and diarrhea. So these symptoms, so you need to tell your patients or your children's parents are calling you to discuss with these things. You need to explain this to them. Then this is another entity which we noticed. Most of you might have noticed, like in US and all, many children were affected. Pediatric inflammatory multi-system syndrome. So PIMS can cause inflammation of the body, blood vessels throughout the body. The inflammation can limit the blood flow, damaging the heart and the organs. So PIM features in common with toxic shock syndrome and illness, that is an illness called Kawasaki disease. So this was the multi-system failure which we can see in case of children, and but many children they get better. And even one of my friend, who is a friend, his son was affected. He was admitted in the hospital for many days, but he is back into normal. Everything is fine now. Now, coming to post-COVID recommendations for post-COVID physiotherapy practice. Here, workforce planning and preparation, including screening, to determine indication of physiotherapy. So you need to determine whether you need to call the patients for therapy to our department, or give a video consultation, or send some exercises. Because the challenge with pediatric rehabilitation and the adult population physiotherapy services are, in pediatrics, the parents are doing the therapy for the child, and we are directing the therapy. In case of adult, we can direct directly to the adult and he can follow the therapy. But here we have in between a mediator, that is the parent, and they must understand the concept and do it for the child. Some children, they at home will not be cooperative to the therapy because they will not know what exactly is happening. Some in department they may cooperate, some children they may cooperate at home, and some parents will be interested to do the therapy. Some parents, they will not be interested to follow the therapy. So few parents, they would like to bring the children to the department. So there are different category. You must understand the by talking to the parents, you must understand what category this particular parent or a family come, and you need to provide the exact treatment so for the betterment of the child. And delivery of physiotherapy interventions including both COVID and non-COVID cases. So usually COVID cases, respiratory and mobilization rehabilitations. Then how to use the PPE in both cases, that we will be discussing in the further slides. Now coming to the protocol we are following in our facilities are you can divide it into three parts: clinic, treatment, and interaction. So the clinic aspect is very important because if many people are coming with children for therapy, social distancing is very important, timing is very important. If you have many therapists providing therapy at a time, in our department we have, in outpatient we have 15 therapists working. So now the numbers are less, therapists are less, but still we daily take around 4 to 5 cases each therapist for the therapy purpose. And treatment, how the therapist and how the patient should be wearing the PPEs. Then interaction aspect. So irrespective of the therapist or the patient, symptoms must be checked for fever, chills, cough, fatigue, when whoever is entering the department. That is the triage point. We have in our department, there is a triage point where we check the temperature and of the child and the accompanying parent, and we strictly inform that only one parent can accompany the child, like not two husband and wife with the child or other relatives. So we make sure that only one. If at all there are two people, we request them to wait inside the car or the waiting area, and it's made sure that the parent and child wear a mask. And less than 6 years old, we won't ask them to wear a mask, but more than 6 years old, they must wear a mask, and the temperature must be less than 37.8. So we make sure that this initial triaging itself, whether there is a problem or not, then only we will start. If the temperature is high, we'll request them to go to a health center for further checkup. Now this is one of the application which is used in Qatar. Widely you can see there are red, yellow, green, gray and green. So patients, this is called ITRAS application. So patients with this QR code green are only allowed for therapy. All other gray, yellow and red, they are not allowed to enter any facilities, not only the physiotherapy department, but other shopping malls or other shops or whatever. You are not allowed to enter if your application is not green. So this will help to reduce the social contact. So, and in our place we have the social distancing footprints has been stuck in the floor, so to reduce the crowding. So we don't know like who is pre-symptomatic, who is carrying the virus. So we make sure that there is enough distance between the people and minimal waiting time. So as the patient come, we will try to take them to the particular therapy area, and where limited number of patients only we will be seen, to make sure that there is social distancing and minimal equipments. We are using the required equipments, the toys and all we ask the parents to bring, and make sure that it is clean. There are many posters and video presentations and write-ups for the parents to follow, so they can understand what exactly the places are following. So this kind of facilities, if you provide in your place and to the parents, it will be good. So the family education regarding what to follow is very important, and it must be followed systematically. What happens, a slight mistake also can develop a chance for the disease, spreading of the disease, and we want to reduce it. And each places in the department, we put a label where how to disinfect the equipments and what all things we use to disinfectant, like sodium hypochlorite solution. We spray it in the equipments after use, and we leave it for about 3 to 10 minutes. Then we clean it to make it disinfected. Between each patient is coming, we are doing this, or with disinfectant wipes. We wipe the equipments and the area of treatment, so that after each patient is coming for therapy, both staff and the parents are in a safe zone. So we have, like, we call them in the morning, the patients, we speak to them, how they feel. We don't know, like, we gave 1 week before the appointment, and the patient is coming, and now after 1 week they are positive symptomatic. We don't know. So we call in the morning and check with them how they feel. Are they better? Is there any cough or discomfort? Then we stop the therapy, or we ask them not to come. And if they are fine, everything is good, we ask them to come for therapy. And there will be in between clinical patient appointment, in between cleaning period. This is a new thing, like, we give particular time for cleaning the area, then we take the next patient. So these all things were not there early, but according to this scenario, many clinics are closed and they don't know how to get back their patients to the department. So we need to follow, and we need to spread these information among the public, so that they feel confident to come to our department for therapy. Now, coming to the treatment protection for patient and for the therapist, we need to follow a particular protocol. So these are the face shield you might have seen. I just saw a few of them wearing all these protective equipments and attending this webinar. It's nice that we must follow all these things, but these are the physical and direct patient care PPEs we must follow. Direct contact, that is hands-on procedures, hands-on mobilizations and exercises you are providing to the child. The therapist must wear a surgical mask, gloves, face shield, gown, hair cover, and physical distancing is not required, because you are wearing all PPE, and N95 mask if the patient is COVID positive. It's better to use N95 mask. And so this must be followed by when you are treating a child in your department. Then either if you are not going to provide a direct contact with the patient and provide therapy, it's a close supervision. You can sit at a distance and you can provide, but you are not sitting more than 2 meters. It's a close contact session, but supervision session, and use of toys and therapeutic techniques, and you are a little bit taking the help of the parents also to provide the therapy. It's kind of a teaching session. There also you need to use this surgical mask, gloves, face shield, gown, hair cover, everything. And in case of positive COVID cases, you need to use the N95 mask. You know that all over the world now there is a scarcity for all these PPEs. So you must use it wisely, so that everybody will get things to be used. So whenever it's required, according to the protocol, you need to follow and use things. And some cases which the parents are very good and they can provide the therapy, you can follow a distance supervision. The parent or the family education, we direct to the parent to do the therapy and they are following. So a surgical mask is a must, and gloves you can use, or if you are not touching the area you don't need to use, but it's always better that you wear a glove. Then face shield and other gown or hair cover is not used. And social distance, you must be sitting at a 2 meter distance and directing the patient, the parent to or do the therapy. So this is the direct or physical patient care format which we follow. And the parent or the caregiver, face-to-face direct or close supervision therapy, make sure that wear a surgical mask and if required gloves. So this is a must, and the parent or the caregiver, when they are attending the therapy, they must use hand sanitizer, and when leaving the therapy also they must use hand sanitizer. So this good hygiene aspects you must explain to the parent and inform them to follow it at home. Based on the priority set up by the department, few children have been seen directly. So we are not seeing all children. Some acute cases, we make a protocol, where we see these cases directly and maybe 2 to 3 times in a day, sometimes 2 to 1 time in 2 weeks, like that, according to the requirement we provide. They have been instructed via phone regarding the few things they need to follow, safety precautions due to the COVID-19. So that's very important. Why we are emphasizing these slides, because sometimes you may feel it as repeating, because it's very important that the parent is aware of this precautions what we are following, and we need to remind them to follow it at home also. Now coming to the video consultation. So video consultation, now in many departments they started using it, and there are many therapists who are self-employed and they run their own setup. So for them also, if there are easy free platforms they can use to continue the video consultation, to keep a rapport with the parents, and so that once this situation is over, or even after the situation also, they can continue the therapy either indirectly by a video consultation, and we can ask them to come for even I used to do sometimes some of my old patients from here. I just do video consultation to give some advices. They are back in India. So considering that tele-practice as an alternative in persons visiting during COVID-19, the first thing is it clinically appropriate based on each patient's need, or is an in-person visit required? You need to decide that according to the acute problem of your child or the relevance, importance of physiotherapy for the child. You need to decide, and the capability of the parents to continue. So then regarding the status of the family, whether they have any exposure to a COVID positive case, then are there any physical, cognitive or sensory deficit? So this is in case of adult patient. If you are doing, there is any issue, so that it is tele-practice is unsafe and ineffective in a particular children. Some family, they say that they don't want video consultation because they don't have a good facility at home. Maybe they don't have a proper internet connection or other reasons. So you need to discuss with the patient or the caregiver regarding what is the status. Are you able to protect the safety of your patient's personal health information? That is very important. Here we have government is provided us with a facility where we need to enter and do, so that government is protecting the documents. So in private practice back in India and all, some people, they will not be able to follow this. Then there are some platforms which provide a very good service where they are, according to their terms and conditions, they are not taking any personal informations or conditions regarding the patients, and ensure that you have a patient's consent. Have a discussion with the patient. You must take the consent from the parent to do this video conference. Discuss the things such as the difference between in-person and tele-rehabilitation service. So you must, there is a difference, and it's a new thing for the patients. And I used to get like videos being sent by the parent to my phone. What I noticed in this past 3 or 4 months is that parents are more interactive. They are sending videos. So I've been, according to our policies, they are not supposed to send by WhatsApp. And also we say, don't send videos or any of your pictures of your kids by WhatsApp. If you want, you must call us and book a teleconsultation. Then we will see the child through the teleconsultation facility and we will guide you. And we can later on send you a report. So these video consult tele-rehabilitation portals, they don't save. They just stream it, and once we disconnect, it's over. But that is what they tell in their terms and conditions. So you need to discuss these things. And if frequent video consultation and we are supervising the therapy done at home, the parents will be more interested to continue therapy at home. That is what we saw in the past these weeks. Now, many parents were calling in between these months, okay, when are you restarting the therapy and all. So we gave this option and they were happy with it, because everyone is concerned about their kids. And risk of privacy, that's what already we discussed. Then any safeguard in the place to reduce the risk. So sometimes at home also we are doing a consultation. You must make sure that the area in our department, we know, like, we don't keep any sharp edge or places where the child can hit or have an injury. So you need to discuss with the parents regarding these issues about the fall. While doing the therapy, must give proper support to the child to prevent fall, because nowadays the fall prevention is one of the major aspects which is followed. Now these are the common platforms, like what we are doing now, Gmeet, Google Meet, or by Geo there is one Care Expert. VC is what we are using in our department, in our facilities. Then Zoom or Doxy.me. So out of this VZ and all, you need to download an application in the phone. What I found interesting is this Doxy.me. Doxy.me is a very simple platform and very interesting one. You can connect in within time, like it's in Google Chrome, you need to connect. So this is about the consultation. If you are doing in the department, if your one PT is consulting in a room, or multiple PTs and different computers, they are consulting, doing a video consultation, the therapist must follow social distance and the precaution protocols, like surgical mask and gloves. All these things must be followed. If you are alone and if you are doing one-to-one with a patient, you don't need to use mask or any other kind of PPEs. Now you can see this Doxy.me. There will be a portal for you, that is doxyme.com/bnjphysio. That is my link. I can email this. Here there is an option. I can email this. I can send by an SMS to the patient to click on this link. After they click the link, they will be asked their names, just their name. When they type their name and they enter, the software will ask them to give permission to use their mic and camera. Once they give permission, they will come in this box. So when I open, log into my Doxyme account, I will be able to see which patient is waiting here. So according to the timing, I will be able to see 1, 2, 3, which patient. So according to the number of patients waiting, I can click and I will be able to start talking to the patient. So this is the format of email or message you can send to your patient. That is doxyme/BNJ Physio. This is my portal which I will send. When the patient click this link, they will go to this page where I can see the patient and I can discuss their problem. They can show me the videos and there is video capture. And this is the free version. There is a paid version also, but I don't think if you are really want to use the paid version, you can go for that. But I use the free version where I discuss the conditions with the patient and I can give them proper directions to follow the instructions, and there we will be able to see the information. But the software or this particular platform is not asking for your patient's age or your patient's any other gender or any other information. What is the condition? Just you need to type your name, that's all. Then you will be able to connect to your therapist, and you can have an interaction with the patient and discuss and give proper instructions to the patient through this video call. And it's very challenging sometimes that the parents need to do the therapy and you need to instruct. So what I use a toy in my hand and I show the exercise using that toy so that the parent can see and follow it with their child. Sometimes it takes 2-3 sessions for the parents to understand and follow the therapy properly, but we have very good results with this video consulting. Now, there are steps to protect the children and others. So you need to give suggestions, not only therapy. It's important that because of this pandemic, you need to give suggestions that cleaning the hand, properly cleaning the hand using soap and water or alcohol-based sanitizer. Avoid people who are sick, coughing or sneezing. Put distance between your children and other people outside your home. If you are coming, make sure that whenever waiting the department to give proper. So these instructions must be given to the parents. Children 2 years and older should wear a cloth face covering over their nose and mouths in public settings where it is difficult to practice social distance. So sometimes putting a mask sometimes will be difficult, and you can do this, and it's always better not to take the children for in a public place, to avoid it. That is the best option. Then clean and disinfect high touch surface daily. Households, common areas like tables and hardback chairs or whatever you use. Even the department, you need to keep the area where we are. So what we are following is, after the patient leave, we clean even the chair, toys, whatever we use, we clean by ourselves to make sure that it is clean. Then we keep the place for some time, then only we will take the next patient. And now coming to video, after video consultation, if you want to send some exercises to the patient, this particular website is very good. So you discuss the patient over phone or by showing some exercises at home at the department, or by video consultation. You gave proper idea, and the parent said, I want some leaflets or whatever, just for understanding, or if I forget, I need to. Some parents, when we do therapy, they take video. We allow them to take the video and they follow that. That time also we make sure that some skilled hands-on technique we will not do, because I don't want the parent to try it at home and have a problem with the child. So some simple activities and exercise to be followed, I will show. But this particular platform is very good, physiotherapyexercise.com, where you can go and you can just select one by one, click, what all exercise you want, and it will be mentioned what exercise. According to the child's condition, you can select not only for the child, for age-related adult, if for all category it is there. And you select what all exercise you want, and there is an option like, you can either send through social media by mobile or by email, download it as a PDF format, then email to the patient. So this is a very good and easy user-friendly website which you can use so that you can send these exercises to your patient. And there is a Word format where you can omit the physiotherapy exercise.com site details, and you can put your clinic headings or clinic name and phone number and send it to them. And it's easy ways, just send to the mobile as an email. So I just wrote the client's email ID, name, and here you can write a little bit of explanation, what all the precautions you need to follow, how many repetitions to be done, then send it as PDF, Word. You can send either way. Then you can send an SMS also. This SMS will go to the client's phone as a link, and when the parent or the patient click the link, it will take them to the website and show all these exercises. And it's very easy, and many patients said it's very helpful. So they see something, they can view it as like this. See, assisted sit to stand from a block. So there is a picture and an explanation. Then we can tell them how many days you need to do, and these informations can be given. So this is what when they click the link and download it, they will get. So it's and there is instructions also. And if they have difficulty in following the instructions given, you can ask them to call you, and you can give a briefing about how to do with the video consultation. So it will increase the confidence of the parent. And this is to continue therapy in this pandemic. We don't want to stop it saying, no, we are closed, we don't have any options to provide you therapy. But if we do this kind of options, if we give this kind of options to our patients, their confidence in us will increase, and our profession, it is good for our profession. Then coming to what infection measures and procedures should I use to clean my clinic? In general, every day, preventive actions can help to prevent the spread of the respiratory disease. Wash your hands, as you know, with soap and water for 20 seconds or more, or use hand sanitizer. Then encourage patients to wash their hands at the arrival, as I already told you, but you need to keep on reminding this, because we sometimes found, oh, I forgot to tell him to use hand sanitizer. Oh, he was not using gloves on mask and he came. We have this situation when the patient is coming and we are discussing, sometimes we forget because it's a new thing for us. And this is going to be our new normal. So mask and all going to be with us for many months ahead, or maybe a year, we don't know. So you need to change the way you think regarding providing the therapy and come with new methods and solutions. So everyone is looking for a new method or an easy way so that we can continue the therapy and provide the therapy to the maximum group of people. And avoid touching. This is very important. You must tell your parents and the child, avoid touching your eyes, nose and mouth with unwashed hands. So washing the hand, after that only you must touch your face with your hand. If at all you go out for a shopping, make sure that you don't touch your face. There are a lot of funny videos also about the politicians who are talking about avoid touching your face, and they are touching. You might have seen in YouTube and all, but make sure that you are avoiding touching. Avoid close contact with people who are sick. If someone is sick, ask them to sit at home. If you are sick, make sure that you sit at home. Cover your cough or sneeze with a tissue and try to throw it into the garbage or into your sleep. Make sure clean and disinfect frequently touched objects or so we don't know, because it was my negligence that this face shield sometimes we will not get it, or we just say okay, there is no issues, because we are treating patients and there is no sneezing or there is no coughing or anything. We are looking every aspects and there is no problem. So we feel more confident. Yeah, why to use face shield and all? Okay, let me treat the patient. So this small mistake can lead to a big problem. And other cases, I was video consulting a child, and the child is doing therapy. He is running and he just jumped and he fall and he was like on the floor. Oh my god! But nothing happened to the child, and mother was holding the phone. She cannot run fast along with the child, and mother want to show the improvement of the child. And mother was telling like he is improved, he is much better than now, he is able to walk independently. The child was not able to walk initially, but he is walking. She was so happy to show the development of the child, and this guy fall down and he started crying. The whole session stopped there, but fortunately he doesn't have any problem. So you will encounter this type of problems while providing therapy which we are not familiar with. So you need to read more and understand and it's like a checklist you have, and follow the checklist every day. Okay, I check this tick, I check this tick, I have this tick. So you need to follow that and provide the therapy. And considering the therapy what we follow are almost the same, but the situation is changed. So the way we dress up or the way we protect ourselves, way we try to protect the children and the parents, all these aspects are changed because of the pandemic. And we need to continue this. These concepts, if you follow, you can slowly start providing therapy to your normal patients. And we want more patients to come to our department. And that physiotherapy is a major part in the treatment of COVID positive cases. We have a hospital full converted into an ICU, because even the corridor, everything is converted into an ICU, and we were providing therapy. There were physiotherapists working. There are still many physiotherapists, even in my department, who are pediatric therapists, but they are treating adult cases. They're providing therapy, and it's a major part, because early mobilization and providing rehabilitation when the movements and all, when the patient, respiratory care and all, when the patient is sedated or on ventilator is very important, and they are providing it. Same time, we are people who are back in following the kids who are affected and they want to continue the therapy. And this particular presentation, I made it to make sure that irrespective of the pandemic, the therapy what we are supposed to follow or the service we are supposed to give is not stopped completely. At least for the required people, we are following the therapy, and these precautions are followed. Even in our department, the cafeteria where we eat or the place where we eat, we have social distancing, we follow it, and we only one person will eat at a time. So even our desk, everything is clean. We don't keep anything in our desk. We take everything out, and our place is just a computer and required things, or just a book to note the informations. So that only we keep. Rest of the things we kept inside the cupboards and all whatever facility available, and we try to follow. And still, it's new concepts, new things are coming up. So we need to update and follow the things, and new concepts as according to the new protocols we need to change. So always you need to listen to new informations and follow it. Thank you. Over to Marimuthu.
Thanks, Biju Nirmal sir, for the wonderful presentation. And now it's the question and answer session. Participants can put their queries in chat box. And I asked Marimuthu to please share the questions in Google Meet platform. Thank you.
Okay, I can see few questions here. I will.
Yes, sir.
May I read?
First question was from Mr. Tamare Selvan. Do we need to change the PPE after each session?
It's always better to change the PPE after each session, because the PPE, if you are seeing a case and you are going to the next patient, you will be sometimes carrying the virus to the other group, which is not affected. So it's better to change the PPE after each session. That's very important. And after removing the PPE, you need to wash your hands before wearing the next one. Usually the face mask we don't change, but if I told you that I had an experience, the child sneezed and to my face, that time we need to change, wash our face and put a new one. But make sure that if you are like treating and if you have close contact, very close contact, like you are lifting a child, like a 12-year-old boy is a big fatty boy. I need, he cannot walk. I need to lift him and move him. I'll get tired, because with the PPE and with the mask, all these things, you will be sweating, and you need to then better to change it and put. But otherwise, also patient to patient, it's better, not better. You must change from PPE to PPE. Yeah. Any other questions?
Yes, the next question was from Asna Khan.
Yeah.
What about the masks? After how much time we should change it?
Surgical. See, the COVID positive facility where we are providing the surgical, the N95 mask, that they patient to patient, if you can change, that would be better. And this mask, N95 mask, is something which it will 95% of filtration is there. Even virus, everything, bacteria, everything is filtered. You need to do a fit test. Here, a fit test is whether it's fixing properly and there is no leak in between the mask. So my colleagues who are working in our COVID facility department, they put the mask and they apply tape. They apply two-sided tape to the mask to conceal it completely, so that there is no air is leaking inside through these areas, and only the breathing is happening. And once they conceal it, they keep it, and they have the face shield. So if they are treating maybe 5 patients, or that is a maximum 5 or 6 patients in a day, they keep that mask and face shield, and they continue the therapy. And in case of face shield, sometimes we need to keep on cleaning it. And in case of surgical mask, you can use it for 2 to 3 hours according to the use, then you can throw it. And if you have many patients, better to change it frequently according to the condition of the patient. Yeah.
So, yes, sir. The next question was again from Mr. Tamare Selvan. Is there any criteria for triage based on the functional ability of the child?
The triaging criteria is not about the functional ability of the child, like when they are coming to the department, but whether you want to bring the child for therapy in our department, it's according to the requirement of rehabilitation. Like, suppose I will tell you an example. We have a case. He was a post elbow fracture. He underwent the surgery, and there was a chaos situation in our department, not in our department, like should we provide therapy to the patient, because that time everyone was panicked because it's increasing, the number was increasing. Should we call the patient to the department and provide therapy? And everyone, even including me, I was panicking whether, because when we went for this triaging of normal people for COVID search, that time I saw a boy. He was working in our hospital. He was normal. He doesn't have any temperature. But about 4 hours later, this particular man or boy, he came to me and tell he's feeling hot and he's feeling like tired and all. When we check his temperature, when I checked his temperature in the morning, it was 37 or 38 like that. But when I checked, it is like 40. 4 hours variation, the temperature is increased. And again I checked whether to make sure that he is like, I told him to wait for 5 minutes. Again I checked and it's more. Then I call the infection control people and we send him to uh, the health center, and he was positive. So morning there was no symptoms, and again when he came around afternoon he started developing symptoms. So in this case you need to make sure that which child to be brought for the department. So this particular child with elbow fracture, initially we didn't give few weeks of session because of this, how to provide therapy, to extract or get proper guidelines for providing therapy. Then we asked him to come for the therapy services. But by that time, his elbow was more tight, and we need to, spend more time to improve his condition. So some cases, if you need to give up, early therapy, so we need to take that risk and bring them for therapy that will benefit the child. Otherwise, children. So according to that, you need to understand which case or acute cases better to bring and provide therapy, and some chronic cases which we need weekly ones and all, we can give video consultation or one therapy session, give proper instruction and follow them through video or phone consultation at home. That is what we need to do it.
Excellent, sir. Any other questions, participants? I think
What
a lot of
about after how much time? Yeah, that is it, right? And about this doxyme and all, it's very important that we search for these. We physios must search for these kind of facilities. Doxyme is just one I got from among the many tele facilities and all, and must use it on our the clinics and all, so that the public must understand what we are doing. We are not sitting at home because there is a pandemic outside. We are providing some kind of facilities so that people can get the real benefit of physiotherapy, and we must with proper precaution start seeing the patient, so that if our confidence we can increase, automatically we can increase the confidence of the patients or the public also. That is very important from my point of view.
So how many times we can reuse a mask, sir?
According to the policy, it's better not to reuse the mask. In a day, if you are using it, it's okay. But if you have, like, you feel like, there is a kind of sneezing or coughing or any other issue or a close contact touch, sometimes the children will hold your face, and, so this kind of issues, you better change it. And N95 mask, when you are treating, so I discussed with the therapists who are working in the facilities, they say, like, with the face shield, they use it for a day and they throw it. And most of these masks are use and throw. You may see many people who are like keeping it home and you are not using. But this cloth mask, which people are using, common public are using, they can wash it and use, can be reused. But in therapeutic setup, it's better to use either surgical mask or N95.
Hope there was no question, sir. I think it was a very good session. Many appreciations came, and many of them would have been have got a good experience in treating the pediatric cases. And now I hand over the session to Ms. Sumaya Fatima. She is going to give the vote of thanks.
Prior to vote of thanks, I request Fatima Surmaya to share the questions in YouTube, which has been posted by our participants.
Good afternoon, all. There is no questions in YouTube. The webinar was so informative and it had impacted a great deal to add up our knowledge and expertise. On behalf of CRC Kozhikode and Department of Physiotherapy, I extend our immense gratitude to Mr. Biju Nirmal Jacob sir, who accepted our invitation and presented the topic in most simple and best way. I owe our thanks to all the participants who wholeheartedly attended in the webinar. We hope that this webinar has added up more to your knowledge and we look forward your presence in future webinars. We also thanks Mr. Jidin, our library in charge, for providing the technical support and advice. And this is Fatima Sumaya signing off. Stay home, stay safe.
Thank you for CRC for providing an opportunity to present in your platform. And thanks for everyone who attended the webinar. Hope it was a useful presentation. Thank you. Thanks a lot.
Thank you, Biju Nirmal sir. Hope we will come up with new topics and eagerly awaiting to meet you again in this platform, sir.
Thank you, Binoy. Thanks a lot.
Thank you, Vijay sir.
Okay, so can we leave or?
Yes.
Okay. Thank you. Thanks everyone. Thanks for attending the program.
Participants, please fill your feedback forms